So tell us a little bit about the vitamin K injection and why they say we should use it and maybe why we shouldn't.
Okay. So the vitamin K, like I've, done some studies on it and also looked into, documentaries and stuff on the different things in the insert about it. So vitamin K, first of all, has black box warning. So it's not just a vitamin like they tell you. It has a lot of other preservatives in it, and it has a lot of things in it that can, cause thickening of the blood and cause increased chance of hyperbilirubinemia. So that means jaundice. Most people know it as that. And I've had lots of parents tell me that afterwards their kids, and that's a cascade of interventions at birth, because if they're injecting you with that, then they have to. So it's almost like create the solution for the problem that we gave, because the baby gets a high bilirubin and the baby has to be hospitalized, or the baby has to be followed up afterwards for high bilirubin to be treated. It prolongs the stay of birth. You see what I'm saying?
Yeah. This sounds very familiar. I mean, it's what big pharma and the system does. It keeps people sick so they can keep making money off of them. I'm not surprised.
Yeah. So actually a newborn peaks at day 8 of life for their actual natural occurring vitamin K levels. So if you think about it, there was a reason why baby's blood stays thin for the first couple of days of life. There's an actual science behind that, and you can look that up and everything. I don't want to go in detail about it, but there's a whole reason why babies have thinner blood, and that is a lot of things to do with, their bilirubin getting high and stuff like that. So on day 8 of life, it peaks, and a lot of people worry about circumcision and all that. Well, they can wait to get circumcised if they choose to circumcise. If they can wait until they're not freshly out of the womb if you choose to do so. And I have my own stance on circumcision now as well. Actually, it's not proven to be more hygienic. There's a lot of misinformation about circumcision as well. If you look into that further, that's a whole deep hole as well. So circumcision is Americans, we have a high rate of circumcision where other countries do not. Americans tend to do it not for religious, just because it's the trending thing to do, not for religious belief. So, we can go into that, but I don't really think I'm going to go into that too deep. It's just something that I tell people to do your homework on. And your baby boy does not have to be circumcised technically to be healthy. And that's why they tell you they need the vitamin K. But why are we injecting baby girls with vitamin K then? That's a good question too to ask.
Yeah, right. Yeah, it is. And like I said, I feel ignorant as a pharmacist. I should have known these things. And I just, I'm learning right now as you speak. And I'm embarrassed as a pharmacist that I didn't know some of these things. But, you just go along with the narrative. You're just taught these things from the time you're in pharmacy school, and you just believe it. And that's why it's so important for people like yourself to speak out. So thank you.
Of course. So that's a good thing to look up too. Like I said, the vitamin K is definitely the increased risk for jaundice and your child having to have a longer hospital stay, or just all the cascade of interventions that can occur whenever we're treating kids for certain things. Like you said, big pharma makes money to create a problem and then a solution. So,
and I will tell you that through this process of educating ourselves and talking to people like yourself, we all of a sudden think of personal stories that affected our kids, and it really angers us that we chose to give them a treatment, and we weren't really given informed consent about it.
No, not at all.
Side effects from it. I mean, we realize this right now when you're telling us, our youngest son had problems with jaundice and hyperbilirubinemia and had to stay in the hospital longer. And you got to ask the question, was it the vitamin K? I mean, like you said, our bodies are created wonderfully, perfectly. And we should mess with that as little as possible. And there probably is a reason that our bodies are created with thin blood from birth. I don't know that reason, but there probably is a reason.
But I think here's the other thing too, as a parent, that is not something that I even had on my radar. Even as a healthcare provider myself, I didn't even have that on my radar, that that's what was going to happen as soon as he was born. So there's a lot of gray or hidden things that people are just assuming that their doctor or their nurse practitioner or midwife are going to be doing on your behalf, and you're just blindly trusting. You are not even realizing that. I mean, I didn't realize that because I worked in community setting and retail. I did not work in the hospital, so that was not even something I even thought about. And nobody said to me, "Oh, by the way, we're going to do this and this and this." Silence, nothing. They just did it.